If the patient is female, ask if she has had a hysterectomy. For a pre-void measurement, confirm that the patient's bladder is full and ask what time the last void occurred. For a post-void measurement, ask the patient to empty the bladder before the scan. Place the patient in a reclining or supine position. Perform hand hygiene and don gloves. Turn the bladder scanner on. Select the patient's gender by pressing the male-female button. The female gender selection accounts for the uterus. Therefore, if the patient has had a hysterectomy, select the male gender. Apply a generous amount of ultrasound gel to the abdomen, taking care not to incorporate air bubbles that may interfere with transmission. Alternatively, apply an ultrasound gel pad to the patient, immediately superior to the symphysis pubis. Orient the head icon on the probe toward the patient's head. Place the probe on the gel about 2.5 centimeters, 1 inch above the symphysis pubis to avoid scanning through the pubic bone, and point it toward the expected location of the bladder, tilting the probe slightly toward the patient's coccyx. In an obese patient, lift as much abdominal adipose tissue out of the way as possible and apply more pressure into the abdomen. Press the scan button on the probe and hold it steady until the scanner beeps. The volume measured will be displayed. In some scanners, an aiming screen with crosshairs will be displayed, with the light area on the screen representing the bladder. The crosshairs should be centered on the bladder, indicating an accurate probe placement. Other scanners use an ultrasound bladder image on the screen to assist in probe placement. If the scanner includes a pre-scan mode that allows location of the bladder in a real-time view, make sure the bladder is centered within the image. If the scanner does not include a pre-scan mode and the edge of the bladder overlaps the side of the crosshairs, or if the bladder is not centered within the ultrasound image, the measured volume will be inaccurate, falsely low. Readjust the probe position and rescan until the bladder is properly centered on the aiming screen. Repeat the scan to obtain an accurate measurement. If using an older scanner model, press Done and then Print if a hard copy is desired. Newer models do not have a Done selection. If using a newer model, save the results, review the examination, and print the results or press Home to do another examination. Turn the scanner off. Remove gel from the patient. Clean the probe with isopropyl alcohol or other approved disinfectant.